Today we're going to talk about contamination-based obsessive compulsive disorder. My name is Dr. Patrick McGrath. I'm the Chief Clinical Officer at NOCD. If you've seen us on our Get to Know OCD podcast and subscribed to our NOCD channel, you've seen some of our longer formats, but we're excited to also do some educational work as well. The work today that we want to talk about with contamination, I think, is really fascinating. Contamination is something that most people think of when they consider what is obsessive compulsive disorder or OCD. But there's a lot that comes with contamination. For example, you might be afraid of, what if I get something on my hands and I have a germ on me, and then I might touch my eyes or my mouth and I could consume it, and then I would get sick and that would cause something terrible to happen to me. But there's also, what if I were to touch something and then touch something else and then someone else touches that? Or what if I were to shake hands or breathe near someone or cough and there were droplets of spit or mucus or something that would get in the air and other people would then be contaminated with those, and now I'm responsible for harm coming to those people. Now I have to check in on everybody. Are they okay? And maybe I should apologize to them. This could even lead into a morally scrupulous issue. Am I responsible for having harmed someone in some way? So a lot of the things we'll talk about with contamination don't just stop at contamination. There could be a fear that I will be harmed by being contaminated, or that I could harm someone by being contaminated. But then there's also emotional contamination. This is a contamination where we may not see a germ or a bacteria or a parasite or something like that, but we know that someone was in an area or sat on a chair that maybe we don't like. We feel they have a different value, or the way they live their life is not the way that we live ours. And we fear, what if I were to sit where they sat? Would their essence still be on that chair, and then it could somehow get on me? And then might it actually even change me or my personality or the way that I view the world or how I interact in it? So as you can see, there's a lot to unpack when we talk about contamination OCD. So let's start with the first one that we usually go with, this idea that if I touch something, I will become contaminated. Now, what does contaminated mean? Well, it might mean I just need to wash my hands or use some hand sanitizer, but it could go all the way to I have to use industrial chemicals to get something off of me just to be sure that that thing is not on me anymore. And I've seen plenty of people who have unfortunately done this to the point of almost damaging their skin because they are using bleach or other chemicals as a way to try to assure themselves that there is nothing contaminated left on their body at all. Now, there's a problem with this. As we wash more things off of our body, and we use more soaps and other things, we start to wash off the oils from our skin. It turns out we need oils on our skin. It's the oils that keep our skin supple and the ability for it to move around our knuckles and not be scabbed or chapped. As you get rid of all of those oils, your skin starts to dry out. As your skin dries out, what happens? Well, it does start to crack and peel and potentially bleed. And what are you going to do if you have contamination-based OCD concerns? You're going to see, oh my gosh, my skin, it's cracked, it's peeling, it's bleeding. I better go wash my hands. And the very thing that you do to try to keep things feeling good for the OCD are the very things that make your hands worse and actually make it more likely that you could actually get contaminated by something because you've washed all those protective layers off of your skin. There's even bacteria on our skin that helps to keep it clean, that eats away some of the bad stuff. When we use all those industrial chemicals on ourselves, we're washing away all the good bacteria in addition to anything that might be harmful. And we're really setting ourselves up for some potential badness happening because we no longer have that good stuff with us. At its worst case, that could even go internally. There are people who are afraid of having things inside of them, so they might over-medicate, they might beg for antibiotics and overuse them. And I've seen this even to a point where people have killed a lot of the bacteria in their stomach and gut. Now, this is a problem because you need that bacteria in your gut and in your stomach in order to even be able to digest the food that you eat. Turns out, it's not just the acids in our stomach and in our intestines that digest food and get all the nutrients out of it. It's also a process of all sorts of bacteria that are in there. Getting rid of all of those is a very serious health condition where people have to then take in other bacteria. So you'll see like probiotics and prebiotics. Those are bacteria being reintroduced into the gut to assure that people can survive and live and be able to eat in a healthy way. Now, that idea that I could contaminate others is also a significant, as we said, fear and concern that people have. If I were to touch this and you didn't know that I touched it and I had maybe sneezed into my hand and now I've left some germs on this table, and then you come along and guess what happens? You touch there, but you don't know that I touched there. And then you rub your eye and now something gets in there and maybe you get a cold the next day. Is that my fault? Did I do that? And what if I wanted to do that, but I didn't even know that I wanted to do that? That could be really bad, that we would think, right? We would go to that nth degree of, was that purposeful? Am I a bad person? So maybe what you will see people do is say, hey, stay away from me. I don't want to contaminate you. I don't want to harm you in any way. And I've seen people do this to the point where they've even gotten in fights with other people because other people have said to them, what's wrong with you? Why are you coming up to me or telling me to stay away from you, that you want to potentially hurt me or harm me? People have had the police called on them in certain situations for this. It's a very significant problem. Could we all potentially get sick? Yes. It's part of being a human. And could we cause others to be sick? Sure. If you've ever had a child and they go to preschool, you could pretty much guarantee that your nose is going to be runny for the next year or two, just like your kid's nose will be, as those preschools seem to be kind of just a bacteria land in many ways, as much as they try to keep it clean. It just is a natural thing. But guess what? That turns out to be really good for young kids to go through all of that. It helps to build up their immune system. By getting all those various infections, they build up antibodies to things so that they will be able to survive into adolescence and adulthood and actually be able to handle a lot of the things that are out there in the world that if they didn't have that early on exposure as an adult, those things would be really dangerous. So it's interesting that growing up, we might say, yeah, good to get infected with things, good to have certain things. But as an adult, and when OCD sets in, we suddenly think, oh, now they're bad. Now they're dangerous. Now there's something wrong with those things. OCD is really good at causing us to have a shift in our life where something that didn't bother us at all at one point now seems to become the absolutely most important thing in our life whatsoever. And we have to give all sorts of time and all sorts of attention to it, because if we don't and we let our guard down, something terribly awful might happen to us. And then, of course, our fault. Or something terrible could happen to other people, and then definitely our fault if that's the case. OCD will always be able to find blame for you about why you did something wrong, why you caused yourself to become contaminated because you didn't follow OCD's rules, or how you somehow contaminated other people by not following the rules that OCD set for you to say, hey, isn't it important for you to keep yourself and everyone else in the world absolutely safe? That third area with the emotional contamination is one that doesn't get talked about very much, but I do want to spend some time on it today because it might be something that's been going on that you don't even know about. This idea that people have some kind of essence about them that they can leave somewhere, or they can somehow infect, quote unquote, a thing with it, is something that OCD really does pick up on. So as I said, I may not want to sit in a chair where someone else sat if I don't like them, because now with their essence on that chair, if it gets on me, will I become like them? Will it somehow change me, cause me to be like that person in some way? This is really, really difficult. I've once worked with someone who, and I won't give away enough details to know who it was, obviously, but had concerns about this idea of death germs. Now, they could not tell me what death germs were, and they also could not tell me what death germs would do to them, but they were very afraid that there were death germs out there, and if they were to get death germs on them, that it could cause something bad to happen. Over time, as I've met with other people who have talked about this idea of death germs, I've heard people say things like they come from cemeteries or places where they know somebody may have died. So hospitals, doctors' offices, maybe fire stations where there's paramedics and the trucks are going in and out because people may have died in the ambulance or something. And this notion that these people who work with individuals who have died are carriers of death germs and they're spreading these death germs around the world. Now, it would be nice if logic worked in all of this, where we could just say, well, if that's the case, why are there any doctors left? Why are there any ambulance drivers or paramedics left? Why are there firefighters left? Why is there anybody who still works in a cemetery where they are surrounded by dead people? And OCD will say it's wonderfully standard answer. Well, they're very lucky up until today, but today might be the day that something bad happens to them. Remember this when you're dealing with OCD. You don't need actual evidence for anything. All you need is a what if. And a what if is strong enough to ruin your life, to get in the way, to lead you to do things that you would never think about doing if OCD wasn't a part of your life at all. OCD wants to be in charge, and it's lied to you, and it's told you, hey, you want things to go well? Well, do it my way. And if you want things to go sour, don't do it my way. Because believe me, if you don't do things my way, really bad stuff is going to happen. The poop will hit the fan. And that's just a little contamination joke, by the way, to put in here. But hopefully you get the point of what I'm talking about. OCD says it has the solution. And yet, I've never met anyone with OCD who said, I think this would be great for everybody else to have, and I'm going to try to spread it around to everyone else. Notice that OCD doesn't seem to be a contaminant. OCD doesn't seem to spread to other people, right? Now, how do we get OCD? In case you were worried, could I give OCD to others? Well, here's what happens. We know that we have genetic issues going on. We know that we have environmental concerns going on. All of us have a genetic predisposition toward things. Some may be medical conditions, some may be mental health issues. And all of us live in an environment where there are certain stressors. We may have a high predisposition for something, but never have a stressor in our life to kick it off. We may have a very low predisposition to something, but have a huge stressor that could kick it off. And everyone else is kind of somewhere in the middle, right? We know that that's where OCD comes from. And we also know that I can't look at you and wish it on you or say, guess what? If you don't do what I tell you to do, you're going to have OCD. But you could be afraid of what if I were to develop other subtypes of OCD. In OCD, this is a very specific contamination issue. I don't want to hear about anyone else's OCD because what if I develop that subtype of OCD as well? Now, guess what? I've never seen it happen. In 25 years of working with people, I haven't seen people who suddenly just gather all the subtypes of OCD and now all of those are part of their life as well. They may be afraid of it happening, but I don't actually see it occurring. But remember, OCD doesn't need the actual thing to occur. It just needs the fear of the thing happening to occur. And if we have the fear of the thing happening, well, OCD is running our life and it's telling us which way to go and what to do. If we listen to what OCD says, we're going to be very stuck in things. We're going to be doing things that we wouldn't tell anyone else to do. I've never met people with OCD say, hey, looks like you're having a rough day. Have you thought about some compulsions? I think they would help everything out. That's not what people do. OCD doesn't have your best interest at heart. It has its own interest at heart. It wants you to do what it wants you to do so that it survives. But we know that there's help out there available, and it's called exposure and response prevention therapy. And if you're looking for help, and if what I've described to you today seems like something that's going on in your life, know that help is available. In fact, you can check us out at NOCD.com if what we've talked about today rings a bell. We've got people standing by waiting to chat with you, and we will do what we can to set you up with a therapist who is licensed in your state, who has expert training in the use of exposure and response prevention therapy to help you live the life that you want to live and not the life that OCD wants you to live. Thanks for listening today. I hope this has been helpful, and I look forward to seeing you again in the future.